Hi, Be Health Empowered family. Welcome back to another week of Excuse Me, Doctor. My name is Dr. Melissa Clarke. Please call me Dr. Mel. We are here every Monday evening. Happy Monday to everybody. And thank you so much for joining us to kick off this amazing week we're going to create for ourselves. At Excuse Me, Doctor, we are here to bring you health topics based on science so that you can be confident and empowered when it comes to making decisions regarding your health, your family's health, and even the health of your community. We clarify speculation, we clear up misinformation, and we debunk disinformation. And we also let you know when things change because as we learn, we let you all know what's the latest. And that's what science is all about, expanding our knowledge. So every Monday night, join us at 9 o'clock Eastern, 6 p.m. Pacific. I want to welcome my newbies, the ones who are joining for the first time. If this is your first time on YouTube and watching us there, please remember to hit subscribe. And if you're joining us on Facebook, please remember to hit like. I really appreciate you for that. So, tonight we have a really special episode. We are going to be talking about long COVID. There's been so much focus around COVID 19 and those who succumb to it. Rightly so, obviously. But actually, the most common outcome after COVID 19 that's detrimental to your health is long COVID. So stay tuned throughout this whole episode because we're going to be having two really special guests who are going to break down what long COVID is. We have someone who actually currently has symptoms of long COVID. They're going to discuss that with us. And we have a pulmonary critical care specialist who is a lung doctor who takes care of patients in the ICU and also sees them in follow-up after they've recovered. And he's going to explain to us everything about long COVID. So make sure that you share this episode, share it with everyone you know, anyone who's ever had COVID or is concerned about post-COVID syndrome. We are going to be breaking it down tonight. So share, share, share. You don't want to miss this episode. Okay? So, it's time to bring in my co-hosts, my co-producers, Wayne Bruce and Miss Lila Mays. Welcome,
Hello,
welcome.
hello, hello.
Hey.
Hey,
How's
how y'all
everything?
doing?
Great. Great,
Good.
Dr. Mill. Great. How are you?
W- Uh, Good, good. I mean, there has been so much that happened this week. We got to jump right into this recap, y'all, because we have a lot to unpack.
Okay.
Okay.
Let's
All
go.
right. So the numbers, we're at 45.8 million new COVID cases in this country since the beginning of the pandemic. Um, we were having about 192,000 new cases a day over the summertime.
Wow.
Thank God it has fallen. We're at about 80,000, which is still staggering, new cases a day. We know that during this pandemic, over 6 million children have tested positive for COVID. So, of course, that's super concerning given that we're back in school now. And spread is still at the highest category level in all but 3 states. So, Lila, you
Well,
need to be proud of California. It's
I
down
am.
from the highest, but down to substantial, which is the next lowest tier down. Um, Louisiana and Florida, all those three are down from the highest,
Wow.
just down a tad to substantial spread.
Florida. Florida's down.
Florida's down. Who knew? And with hospitalizations, we're having about 6,600 average daily hospitalizations. Those rates of new daily hospitalizations are going down as well in all age groups. That's great because last time when we talked about it, it was going down, but not for children. So now it's going down for everybody.
Wow.
And we are at 722, actually over 722,000 deaths from COVID. We're down from 2,000 deaths a day over the height of the summertime, down to about 1,200 deaths a day. Still devastating
Yeah.
But hopefully we're continuing to head in the right direction.
Still devastating, and certainly, I'm sure most of our viewers have heard about Colin Powell, who passed away. Um, Fully vaccinated, but with some other conditions. Dr. Mel, can you just touch on that as we go into some vax facts? I lost a
Yeah.
friend last week who was fully vaccinated but had some underlying health conditions as well.
Yes, and my heart goes out to you and also obviously to the family and friends of Colin Powell.
Hmm.
His death is truly a loss for all of us in America.
Yeah.
Yes.
We also learned today his family released the details that he had an underlying condition called multiple myeloma, which is a cancer, a malignant cancer of the B cells in your blood system. What are those?
Okay.
B cells are the antibody factories of our body. They make antibodies. That's what they do. So, as you can imagine, somebody who has a cancer of their B cells, that means their B cells are not working. So,
Right.
even though he got vaccinated appropriately, apparently he never really mounted an immune response enough to be able to protect him against the ravages of COVID. And
Wow.
so it's not necessarily the vaccine doesn't work, it's that in some people who have these underlying issues where their immune system isn't functioning, they can't respond to a vaccine. And so unfortunately that appears to be the case for General Powell. So
Hmm.
Yeah.
rest in peace. And he definitely, um, he was an incredible American citizen
He
of
was.
Jamaican
Indeed.
heritage. I may
Indeed,
add.
of Jamaican heritage. Yes, yes,
Hmm.
yes.
Yes,
Ultimately from
yeah.
Jamaica, right? I think it's so important to talk about. People will take this a story like this and run with it. Like he was fully vaccinated and he still died.
They're
Hmm.
already
Uh,
weaponizing it. They're weaponizing it on Fox already.
Already,
Yeah,
Hmm.
which just pisses me off.
yeah.
Anywho,
It,
uh,
Anywho,
from producer
well,
Lila, get vaccinated. Okay.
well,
Hmm.
we are here
Yeah.
to set the record straight, and I'm glad you brought it up. Thank you.
Hmm.
All right. So facts.
So yeah, we're at 189 million people vaccinated. And just for those folks who, say the vaccine doesn't work, there have been 7,000 deaths of people who are fully vaccinated out of 189 million people who
Million.
are fully vaccinated. So that 67% of all eligible people 12 and over are fully vaccinated.
Wow.
And for our 12 to 17-year-olds, this is the group that's the least vaccinated. About 46% of them are fully vaccinated.
Okay.
Um, and shout out to the older 65s, over 65s. I think close to like 95% of them are
Yeah.
vaccinated. So they are
Hmm.
not playing with y'all. They're serious, and 10 million of them have gotten their boosters already. So
Hmm.
yeah, they're all in.
Hmm.
And some high profile people have decided they're going to get the vaccine, right?
Yeah, I heard. I'm a football fan, so uh, being a football fan, a sports fan in general, I've
Right.
we
Let's be clear.
let's be clear. It's not just football; it's sports. So we hear that Cam Newton got vaccinated. I
Right.
guess he's
Yeah.
trying to get
Okay.
back into the NFL and
Oh.
He had been let go by the Patriots, right?
let go by the Patriots. They said it wasn't because of his vaccination status, but no other team picked him up. I
Yeah.
just some people I think they just want people to be eligible to play, you know?
Right. Right. Well, good for him. I'm glad he made that decision. I hope he can get his career back on track.
Yeah.
Good luck,
And
Cam.
I hope he has some influence on some other athletes.
Yes.
Um, Speaking of vaccinations and boosters, where are we? I'm ready for my booster.
The booster's back.
So if you
I
had
want one.
Pfizer,
I
right? If
know.
you had Pfizer as your original dose, you have the green light to go ahead and get a booster. If you're over 65, if you have an underlying health condition, or if you have occupation that puts you at high risk for contracting COVID. So that's anybody from a bus driver to a school teacher to a healthcare worker. If you got Moderna or Johnson and Johnson, we're trending in the direction, but we still don't have the green light yet. So the FDA subcommittee, their panel has said that for Moderna, they're recommending to the full FDA that booster be allowed in the same circumstances as the Pfizer booster. So for people who are high risk or over 65 or have underlying health conditions. So we're awaiting the final FDA approval, and then also it has to go to the CDC for review as well. Same thing for Johnson and Johnson, but they're actually recommending it for anybody who got Johnson and Johnson the first time around. So not just high risk, but anybody over 18 who got Johnson and Johnson. So and then a lot of people have a question about the mix and match. Like, okay, if I got Johnson and Johnson the first time, can I get Pfizer and Moderna this time? Absolutely. Given that, once we hear what the final pronouncement is, they've already done the studies to show that mixing and matching is actually a good thing. If you had Johnson and Johnson, you actually will probably do better getting Moderna or Pfizer afterwards than getting a repeat Johnson and Johnson. If you had Pfizer or Moderna and you get Pfizer or Moderna afterward, as your booster, actually, that's a great scenario as well.
Correct.
Okay. There we go. You heard it here first, folks.
Yep.
So a couple things are going on in the chat, and people really want to know about booster and the flu vaccine together. Actually, Nurse Meaty Clarke Barnelli, who's a friend of the show, says she got her booster and her flu shot together.
That is absolutely right. You can do it, make it a one-stop shot. So you can actually get one in either arm. It's perfectly fine. We actually talked about it on the last recap that it's safe to do and convenient. So go for it.
All right, and there we go. So that brings us to why you so salty, or why are you so salty? Depends on where you're from.
Thank you for the subtitles and translation. So the FDA has called for manufacturers to add less salt to our food, y'all. And that is because of the epidemic of strokes and high blood pressure related to how much salt we're eating. So if you think about those little restaurant salt packets, we're supposed to be eating no more than 2 of those a day for our entire amount of salt, right? We're really eating more like 6 or more of those a day. And a lot of it is in our packaged food. Over 70% of it comes from our packaged food, processed food, or restaurant food, especially fast food. And as you know, those things are they're affordable, they're cheap. So they get marketed to people who can least afford health-wise to eat them.
Right.
Many Black and brown people. And so that's leading to the strokes and heart attacks that we're seeing in our communities. And if we cut salt by just 12%, our salt intake, we can decrease the number of heart attacks and strokes in the United States by 200,000 a year.
Wow.
So what we personally can be doing is when you cook, add salt when it's time to serve the meal as opposed to adding it while cooking. That way people can season it to their taste. Use more salt-free seasonings, use more herbs, because that adds flavor without adding salt. And even Himalayan sea salt actually has a third less sodium than regular table salt. So I kind of hesitated to mention that because people will use it and then they'll just use more Himalayan sea salt to get the same flavor. But use the same amount of Himalayan sea salt that you would have used your regular salt. You'd be good.
You definitely ain't going to get Nana, aunt, grandma, auntie, down south auntie to get on some Himalayan sea salt. You're not going to have
I could go on. I could go
Well,
on and
not
on about throw that
necessarily,
white
you know
salt
what?
out. Throw that. Okay. that Morton's, get it out of your kitchen.
Yeah,
Like,
get the
get
little
that stuff
girl with
out of
the
your
get the
kitchen.
little girl with the umbrella out.
Seriously, get it out. Get some
Yeah.
good stuff, some spices, and
There you
zhuzh
go.
it up
Fresh
with
herbs. Can't go
yes,
wrong.
zhuzh it up with some fresh herbs and some spices. I was
Zhuzh.
watching a pretty popular internet chef, and man, he put Creole seasoning
Oh
salt, a
yeah.
tablespoon of
Oh my
regular
God.
salt,
Oh my
half a
God.
cup
A
of sugar.
tablespoon.
I'm like, a tablespoon. And then
He's
was
trying to
trying to
kill
like tell
people.
people, this pot of
Right.
greens is gonna serve 6 people. So really the breakdown of the salt, I'm like, dude,
Exactly.
Bruh.
Exactly.
Stop.
ooh, you trying to
Yeah.
kill people.
So
Okay.
So
everybody
be
get the
careful out there in those salt streets, y'all.
them salt streets ain't playing.
Be careful in them
Get
salty
get them
streets.
pink Himalaya sea salt. That pink
Yeah.
Himalaya from Marshalls and everywhere. You
Right.
see it.
You can't get
Even
you
Trader
get it
Joe's
anywhere.
has it.
Trader Joe's,
Right.
Marshalls.
You're
You
right.
stand in line at Marshalls. They have like a supersized
All that
version of it.
stuff. They have
Right.
good stuff though, like sugar-free syrup, all kind of stuff. Okay.
All right, all
Anyway.
right, all right. Let's
Okay.
get back on
So
track.
what's our next?
Okay.
Y'all
Back on
got
track.
something else, I
Plastic
know.
water. Plastic water bottles. This is like really. So I use a glass bottle everywhere.
Good.
My office, side my
Good.
bed. Tell me why I shouldn't keep a plastic water bottle in my car, Dr. Mel, and
So
use that to drink out of. Wayne, don't be huffing around.
yeah. Yeah, because the heat, when as you leave it in the car, the heat can react with the plastic of the bottle and release chemicals in a process known as leaching. So,
Right.
um, and the type of chemicals released depends on the type of bottle, but the most concerning type are the reusable plastic bottles that include a chemical called bisphenol A or BPA. It's a
Yep.
chemical that's used to harden plastic. So, um, it's BPA is actually in a whole lot of stuff, medical devices, water bottles, the lining of canned foods and drinks, and many of the products. Actually, 90% of us have some BPA in our body already. And we
Yeah.
get most of it by eating foods or drinking water that's been in containers that are made of BPA. Um, and the danger with BPA is that it can have a range of negative health effects on our body, including mimicking our hormones and making us gain weight. So, the good news is that most popular drinking waters are BPA free. The bottles are BPA free. So that's good.
Mhm.
But in general, it's better to store food in glass containers rather than plastic. Just like you mentioned, Lila, you use a glass bottle. You want to look for BPA free storage containers. Avoid plastics that have a 3 or a 7 recycle code on the bottom because those tend to have BPA. And don't use plastic containers in the microwave. Just transfer it onto a plate and do your thing.
Get you some good old Tabitha Brown mason jars. Drink your water out of those.
There you go.
Isn't that special? A mason jar. Tabitha Brown.
Is that your best Tabitha Brown
That's the
impersonation?
best. I can't. I gotta have a big afro, big
You're
old
right. You
smile.
got a ways to go.
We love
You
her.
got a
We
ways
love
to
her.
go.
We love
Yes.
Tabitha. We love her. So what's up with aspirin?
Lots of changes. Yeah.
Come on now. I some people I know recommend taking aspirin once a day.
Right. Well, the thing is, don't casually take aspirin anymore. That's the bottom line.
Oh,
It's okay. Occasional aspirin is safe for most adults, but don't put yourself on an aspirin regimen meaning a daily aspirin, unless you consult with your doctor. And the reason why is aspirin is not a harmless medication if you use it on a daily basis. It's associated with other side effects, especially bleeding. So if you're already on a daily aspirin because you've had a heart attack or stroke, or you have known heart disease or blood vessel disease, that's fine. Stay on it. Talk with your doctor, right? Um, don't make any moves in terms of stopping it unless you talk with your doctor. If you are at low risk for a heart attack, right? You've never had one and you're at low risk. The benefits of taking an aspirin, daily aspirin, do not outweigh the risks of bleeding.
Oh.
The higher the risk of heart attack that you have, so just so that you know what those risks are, if you smoke, if you have diabetes, if you have a family history of somebody in your family dying of a heart attack under age 55, if you're obese, if you have high blood pressure or high cholesterol, if you have those kinds of risk factors, you're going to want to talk to your doctor, because it might be that might make sense to start an aspirin regimen, especially if you're age 40 to 59. If you're over 60, the United States Preventive Services Task Force, the one who's making these recommendations, don't recommend starting if you're an aspirin if you're over 60. But of course, these decisions, these are recommendations, they really need to be made with your doctor. So, like I said, the bottom line is, if you're taking an aspirin because you've had a heart attack or a stroke, don't take yourself off of it unless you talk to your doctor. If you have not started on aspirin, don't just start on it to start on it. Do it in conjunction with your doctor, who can help you weigh the risks and benefits of doing so. So that is our recap, y'all.
There you have it. There you have it.
Thanks for running through it with us.
You do know what time it is, right?
What time is it?
The weekly debunk. Stopping misinformation in its tracks.
Tanisha Twitterfinger said, I heard my minister can get me out of taking the vaccine for COVID by writing me a religious exemption note. Hey.
I don't know about that. Hey, excuse me, doctor. Is that true? Hey.
Probably not. It is probably not true. So whether an employer grants a religious exemption to a vaccine requirement is generally based on the judgment of the employee's sincerely held religious beliefs. So you probably should have a track record. Whether the accommodation poses an undue hardship to the employer or would present a direct threat to the health and safety of others. So if that employer services a lot of the public, that might be an issue. So just so everybody knows, there's been no major religion that has come out in opposition of the COVID-19 vaccines. That includes Jehovah's Witness, Christian Scientists, and the Catholic Church have all issued statements that their religion does not prohibit their members from taking the COVID-19 vaccine. The Pope even declared that getting vaccinated was an act of love. And, there's been a concern about whether, fetal tissue, aborted babies are involved in the vaccines. Fetal cell lines were used in the vaccine's development, and they're commonly used with all kinds of pharmaceuticals. So to receive a religious exemption, employers can request additional information from the employee, including asking questions like, do you take medicines like Tylenol or Motrin, which were tested in fetal cell lines? So, we even saw this week, or actually I think it was last week, where Andrew Wiggins of the NBA requested a religious exemption. It didn't quite work out for him, and he ended up getting vaccinated. So it's probably going to be a real long shot, unless, it is a sincerely held belief that can be documented and shown across many areas of your life, and that it would not present a danger to your employee or the people that your employees serve.
All right. And there you have
your
it.
Employer. Yeah.
And there you have it. Tanisha Twitterfingers was on the hot seat. She got fried tonight.
Well, I don't know about all that, but it's good that we set the record straight. So thank you all to my wonderful co-producers for joining me. And we are going to segue now into our topic for tonight, which is long COVID. So, the discussion around COVID has focused so much on vaccination, on personal freedom, on hospitalization and death. But the most common occurrence around COVID-19 in terms of its negative health effects has been a syndrome called long COVID. So here are some numbers. 1 in 5 survivors experiences a decrease in mobility after having COVID. Almost 1 in 4 survivors have difficulty with concentration, and nearly 1 in 3 patients are diagnosed after having COVID with general anxiety disorder. So I'm joined today by a distinguished physician, a pulmonologist, and also um, a young lady who is a survivor of COVID and unfortunately has long COVID. So her name is Ceshelle Evans. She's a health management professional, graduate of Howard University, proud graduate of Howard University. She's a mom, and as I mentioned, she survived a bout of COVID 19. She's going to share her journey with us um, around her COVID long haul symptoms. Thanks for joining me, Ceshelle.
Thank you for having me. Thank you. Thank you.
Absolutely. And our second guest, Dr. Leslie Kingslow, is a pulmonary critical care specialist in the Washington, D.C. area. He's been serving patients for over 20 years, a dedicated, excellent physician. He is partner and owner of the Pulmonary Critical Care Associates PC. And if I might add, he takes excellent care of my father in law, who is probably alive today because of him. So I just want to give you that shout out and thank you so much for joining us tonight.
Thank you for having me, Melissa.
Absolutely. Well, let's get into it because we have some questions. I know the audience is going to have a lot of questions. So, Dr. Kinslow, I'm going to start with you. What have you been seeing in the hospital? So, not necessarily long COVID, but in terms of your intensive care work, you round on patients in the intensive care unit. What have you been seeing in the hospitals in the DC, Maryland area?
So, when the pandemic initially broke, we saw a massive influx of patients who suffered from respiratory illness and GI illness directly related to COVID 19. And we really didn't have a handle on how to manage these patients. We used all the tricks in the book when faced with patients with respiratory illness and critical disease. And unfortunately, we are appreciating a sizable mortality rate, particularly in the elderly population and those patients with comorbidities, obesity, diabetes, immune suppressed disorders. With the advent of protocols to try to improve outcome using different techniques with mechanical ventilation, prone ventilation, extracorporeal mechanical oxygenation, we were able to improve survival. And then with the advent of monoclonal antibodies and remdesivir and the use of systemic steroid therapy, we saw a gradual improvement in survivalship.
Yeah.
Unfortunately, I'm sorry.
Yeah, I was just going to break down a little bit. Prone ventilation means laying on your stomach, and extracorporeal membrane oxygenation means your blood gets pumped out of your body in order to oxygenate it and pump back in.
Thanks.
So, yeah. I mean, it's serious. I just wanted
Right.
everybody to appreciate the lengths that doctors and what happens, unfortunately, to the people who are very sick, and the lengths that doctors have to go to sometimes to really ensure their survival. So, but I'm sorry, keep going.
So, with the advent of the vaccines for COVID, we appreciated what everyone appreciated. We thought that this was a magic bullet, that we were going to see a dramatic decline in disease state and the presentation of patients to the hospital with COVID, and that's what we appreciated with those who are vaccinated. Unfortunately, as I'm sure you've attested to with this program, the numbers of unvaccinated continued to hit our doorstep, and once we started seeing the progression of the Delta virus in our community, the numbers continue to be pretty dramatic. The virus is more readily transmitted. Um, it's easily contracted, more easily contracted, and it's much more virulent and caustic. So currently, we still have, although the numbers of hospitalizations have declined in the DC area, we're still seeing a sizable number of patients who are presenting to the hospital unvaccinated and requiring aggressive intervention to keep them afloat. We're still seeing mortality rates. We're still seeing patients who are unable to liberate from mechanical ventilation and having to go to long-term facilities on life support. And we're seeing patients with long-haul COVID as well.
Wow. Well, I want to go to Ceshelle. Ceshelle, tell us about when you had COVID. When was it? What was it like for you?
So I had COVID back in February. I typically was feeling well overall in the beginning. I started getting a little feverish, then my body kind of shut down. What prompted me to honestly go to the doctor, because COVID was symptoms were so close in the beginning of them, at least to cold symptoms, that it was like, okay, I'm just going to wait and see. I actually had to take my son to the ER because he had a fever of 101 out of just kind of nowhere, and it came about in about a day. I took him, found out that he had COVID, and they had to like hospitalize him for the night. So kind of stayed there, found out I had COVID, and I also found out his dad had COVID. So we all had COVID. So it took a while. Honestly, it took the full 2 weeks, to be honest, to get better. But the symptoms after the fact that I still do have is the loss of taste, the loss of smell. Um, and actually, I just found out just now. I know that you possibly mentioned it to me before, but concentration, that has been harder for me, and I do have anxiety, which has um, declined since I've gotten COVID. And I was trying to figure out what actually was going on. Like, is it me?
I'm
Is it
sorry,
because
you said that your anxiety has declined after getting COVID.
yes, it's declined
Okay.
after getting COVID. So I was doing
Okay.
well, even within the pandemic, not really being able to be around people and things of that nature. But even with the world opening back up, it still has been worse. Been just trying to figure out and pinpoint why, and I kind of was able to do so with your help and some research the other day. So it just all made more sense to me, with
Mhm.
just trying to figure out why. So it's just certain things
Right.
like that, but taste and the smell, of course, and the loss of concentrations most of the
Okay.
time.
Well, since Ceshelle has brought it up, Dr. Kingslow, can you break down what is long COVID and why does it happen?
So, Keyshawn, I'm sorry, Ms. Evans, I should say.
Ceshelle.
Michelle, I'm sorry. She delineates this panoply of symptoms that we appreciate quite commonly in patients who've suffered from COVID. Long haul COVID is this inflammatory state that arises following the disease, and there's no way of predicting who's going to contract it. It appears that a sizable percentage of patients who've sustained COVID are going to have long haul syndrome. And when we look at the literature, it looks like about 30% of patients who've had COVID, regardless of their severity, whether it's mild or moderate or severe, 30% of these patients are going to suffer from this. And there's no one pinpoint sign or symptom. There's a variety of organ states that can be involved in this. Respiratory patients will have lung injury with fibrosis of the lung. They can have new onset asthma, cardiac
Meaning scarring of the lung
scarring,
when you say it.
surely.
Yep.
They can have new onset congestive heart failure where the heart pump doesn't pump as efficiently and they
Hmm.
lose exercise tolerance. They can have resting tachycardia where the pulse rate episodically will elevate with no warning whatsoever. It could happen at rest or with exertion, or it could be throughout the day and night. Patients may have skin manifestations. Um, Ms. Evans reports this sort of brain fog syndrome, this memory loss, this inability to recall, or brain fatigue is another term that people use, and that happens in about 8 out of 10 people who have long haul
Wow.
COVID. The
Wow.
neurologic manifestations can present with headaches, in about 68% of patients, numbness, tingling in about 60% of patients, muscle aches in about 50% of patients, and a loss to taste and smell in about 50% of patients. So the neurologic manifestations are quite well recognized in this. Unfortunately, there's very few treatments that are available to treat long haul COVID. When we look at the lungs, there's literature that was published about 2.5 months ago in Nature that looked at the role of protracted systemic corticosteroid therapy to try to decrease underlying inflammation in the lungs in the setting of scarred lungs due to COVID. And that's been shown. The study looked at patients who were on supplemental oxygen at the time of the onset of the
So pretty sick people.
Yes, and they
Yeah.
found that those patients who took systemic steroids versus the control group, people who were just managed conventionally, those patients who were on the steroids, a sizable percentage of them were able to liberate from their oxygen, home supplemental oxygen. But
Good.
again, the underlying residual scar tissue is a main player, and we don't have any large studies that have looked at the role of other alternative agents to try to alleviate the lung injury.
Yeah. So thank you, Dr. Kingslow. So Ceshelle, how are some of the symptoms that you mentioned? How are they affecting your life? Is it something that you don't think about, or is it something that you notice from is it affecting you on a day-to-day basis?
Yeah, for sure. To make it a little bit more light, I sometimes can't smell if my son, did the number two yet. So I know that
Yeah.
that is off, because I'm
Yeah.
like, because I know this doesn't smell like this, like this can't
Right.
smell the same. Like there's no way. So that of course with my anxiety, of course, but I'm dealing with that on my own. When it comes to taste, a couple of days without having any type of appetite, and that's unusual. Just
Mhm.
out of a sudden, all of a sudden, just having no no desire, no desire to eat, no taste. I'm drinking water. Water may start tasting really different, which is really
Mhm.
weird to me. I was trying to figure out what was that. It started tasting like pennies one day and
Yeah.
went back to normal like the next day. Then it just started tasting weird for a second and then it went back to normal. So it's just here and there when it comes to it.
Right.
It's definitely daily. Yes.
So it's, and just to be clear, it's not necessarily always a loss of taste or smell. Sometimes it's odd smells and odd tastes, which is what I hear you saying, and I've heard that from a number of people.
Yeah.
So Dr. Kingslow, what are you seeing in your practice in terms of people who have survived COVID? Are you currently taking care of anyone with long COVID?
I have a number of patients in my practice with long haul syndrome. Um, Interesting that Ms. Evans reports a number of these symptoms. We find that a sizable number of patients are having to miss work. On average, in my practice, I'd say 50% of my patients have been out of work for at least 10 days or more because
Mhm.
of their long haul syndrome. Um, as I mentioned earlier, I'm a pulmonologist, so I have a sizable number of patients with pulmonary disease, and we're seeing a good number of folks coming into the practice who have residual scar tissue in their lungs because of COVID, and they're frustrated because unlike other illnesses, even other viral illnesses, it's very unusual for issues to persist for this long. We don't see this in the flu or any other conventional
Mhm.
viruses that we're familiar with. Um, and they asked the question, well, what can I do? What can I do to help myself in light of lung disease and scarred lungs? And unfortunately, there's no silver bullet. There's nothing that's available to date to try to treat these patients. We do have medications that treat patients with scarred lungs because of other culprits, other causes, but we don't have any literature looking at those agents in this population.
Right.
Many folks are coming in with additional respiratory issues like bronchospasm and asthma, And we try to treat that with the conventional medications. We have patients who have new onset pulmonary high blood pressure because of their COVID, and we treat that. As you probably mentioned some time ago in your telecast, there is an increased incidence of patients with clot formation due to COVID. The
Mm-hmm.
virus causes a sort of a hypercoagulant or excessive clotting state in its acute phase, and it also causes people to be immobile, and hence clots form. And we're finding a sizable percentage of patients coming into us with chronic clots, clots that haven't dissipated post COVID, and
Mm-hmm.
that
Which could
result
happen in the legs, or they could happen in the lungs, or in
the
the blood
lung.
supply to the kidney or to the brain. Yeah, they could happen anywhere. Yeah.
Right, and with the lung, it causes respiratory failure over time. So, although
Mm-hmm.
that's rare, but it's something that we search for, considering that we don't have much in our armament to try to improve
Right.
patients with lung injury in the face of this.
So before we go to our audience questions, I do want to just get one more in, and that is, have you heard anything about people getting vaccinated and that helping to alleviate the symptoms of long haul COVID?
So there is evidence to suggest that post vaccine there is a heightened effect of our immune system. And there are reports in the lay press as well as in the medical literature that patients do appreciate a reduction in their symptom complex with long haul COVID post vaccination. And interestingly, we're seeing that in patients with other autoimmune disorders. There's some reports that have appreciated a reduction in their exacerbations of their disease state in the setting of the vaccine. In particular, connective tissue diseases like rheumatoid arthritis and systemic lupus erythematosus. There's case reports and small case studies that have reflected a reduction in their exacerbations post vaccine.
Great. Well, that's good news. So I think this will be a good time to break and bring in Lila and Wayne again, and to see if we have any questions from the audience for our panel, for Dr. Kingslow or for Ceshelle Evans.
There we go. There we go. How's everybody? Thank you, Dr. Kingslow. I just want to say it is always great to hear you talk, and I was just amazed that you were able to put the word panoply into a sentence.
That's what you got from this?
Not that anybody else understood what that was, but panoply, yes.
It's HU, baby. It's HU, man.
A proud Howard University graduate.
So we have a few questions, and this question comes from Johnson L. Chandler. Please elaborate on the skin manifestations.
Dr. Kingslow?
Well, there's a variety. I'm not a dermatologist, but I have patients who've presented with burning sensation in their hands and feet. They get spontaneous rashes about their skin. I don't really manage those folks. I just turf them off to the dermatologist. But my experience in that regard is rather limited. I'm not familiar with what the treatment approach is with those patients. I would assume, like other skin issues, patients are being placed on systemic steroids to try to curtail their symptom complex, but I would not be the one to elaborate on that.
Right. And we have
Right.
another question, similar vein from Michelle Walker Scales. Have you seen hair loss as one of the long haul COVID symptoms?
Well, when we're faced with a systemic disease state like this, particularly when if it's advanced and we have multi-organ system failure, it's not only the lungs that may be involved, or the kidney, or the brain, or the heart, but surely the skin's going to appreciate some manifestation, and the hair follicle is part of that complex. So I would not be alarmed if patients are noticing hair loss. I don't necessarily get that complaint in my practice, but it would not alarm me if that's been appreciated. When we look at the list of disease of organ systems that are injured in the face of this, skin is mentioned. It's not really at the top of the list. It's really the respiratory system, chronic fatigue, and neurologic manifestations, and then the list extends downward from that.
Mm-hmm.
And I would add, I think there's something like 290 symptoms that have been reported as part
Ooh.
of the long haul syndrome. So just as Dr. Kingslow says, it's the entire body that is at risk of being affected. And
Mm-hmm.
so that list of 290 symptoms basically touches each and every part of our body somewhere.
Lie.
I have a question from Yvonne Smith. Will the lungs heal after having been affected by COVID?
Dr.
It
Kingslow?
varies from patient. It varies from patient to patient. There's no real way of predicting um, whether your lungs are going to resolve the insult or not. Understand that this disease state is a causes diffuse inflammation throughout the lung tissue, and it's dependent upon your viral load, your own body's immune system and its ability to amount an antibody response to the virus before the virus can cause progressive insult and injury. So again, there's no way of predicting whether your lungs are going to heal or not. It's really time will tell. We do surveillance of the lungs with breathing studies. We'll do follow-up chest X-rays. We'll do CAT scans to get a sense as to the gravity of the insult. And as I mentioned earlier, there's a role for systemic steroids in patients who are oxygen dependent. That's the population that the study was done. But I find in my practice that we're placing patients on systemic steroids who have evidence of underlying lung injury, whether they're on supplemental oxygen or not. And we've seen a boon in those patients in that a percentage of those patients have shown improvement to the extent where they're able to do more, exercise better, their oxygen requirements are lessened, and they feel better. But that's not universal, and there's no way of predicting who's going to fall into that category.
And I want to pick up on one thing that Dr. Kingslow said, because he said it so well. The virus, it depends on how quickly your body is able to mount an immune response and produce antibodies against the virus. That's where vaccination comes in, because when you get vaccinated, you have antibodies at the ready. They've already been formed. So you don't have to have that lag period of time to wait for your body to come up with the correct antibodies. And that's why vaccination gives you an advantage, because your antibodies are at the ready. They're ready to go.
Okay. Wow. This person has written several interesting questions in the chat. So I can't take all of them, but I will take one from Carmel Zeno. Carmel Zeno. COVID-19 is so random with symptoms. How can the vaccine really state that it will help lessen the severity when people are already unique in their DNA, pain tolerance, and reactions?
Do you want to take a stab at that one, Dr. Kingslow?
I'll let you fly first, and then I'll follow up.
I think what Mr. and Miss Zeno is saying is that we are each unique. So how do you know that the vaccine is going to work, given that we're all unique in our particular DNA footprint? And that's the beauty of the human body, that our bodies are programmed to respond when presented with a virus or a bacteria to produce antibodies. And what the vaccine does is it presents that virus or bacteria in a way that is harmless to our body, meaning it doesn't cause the disease that it would if you presented the full virus, right, or the full bacteria. So it's a relatively harmless way to expose our body to one of those germs and have our body produce antibodies. And that happens regardless of the fact that we are genetically unique, because the thing that unites us genetically is that we're able to do that. So I hope that answers your question. I'm not quite sure. I wasn't 100% sure I understood it, but that's my answer to what I think I understood.
I don't have much else to add. I think that it's important to recognize that the data is clear that millions and millions of patients worldwide have been vaccinated, and all of these patients have a different phenotype, and there's subtle differences in their genotype, their gene pool. But even with that, it's been shown, it's been proven that post-vaccination, your risk for mortality, for death related to this virus is near nil, and your risk for hospitalization is reduced dramatically. And I think that should be the take home when trying to tease through some of these concerns.
Okay.
Okay. I have a question for Ceshelle. Did you, just to follow up on anxiety, did your anxiety actually decrease or increase with COVID?
It increased.
Okay.
Yep.
And
So, oh, sorry.
no, go
No,
ahead.
go ahead.
Kind of to gauge it, not to like put all my personal business out there, but it went from one medicine of milligrams to like up 10 over the like last 6 months, because other options and avenues weren't working anymore. And I honestly didn't understand why. So
All right. And you had not necessarily linked that to it possibly being related to long COVID, but it possibly might be.
100%, because
Yeah.
I've been in the same position over 2 years, and it's like, what is the real difference of my life that's been changing? Being a mom has gotten easier, work has gotten easier, everything has gotten easier, so why am I getting worse? It just didn't make any sense. It doesn't make any sense. So when you think of all the other factors that are put in there, yeah, when you're
Okay.
just kind of sitting up there just really trying to understand. So
Well, thank you so much for sharing that, because as you share, I think that will also inspire other people to sort of stop and think, could what I'm going through be related to the fact that I had COVID before? So thank you for being transparent like that and sharing with us.
Can I piggyback?
Definitely.
Can I piggyback on
Yeah,
Ms.
please.
We're seeing a dramatic influx of patients who are presenting with psychological challenges post-COVID. Um, and we're seeing that healthcare personnel are overwhelmed, particularly in the mental health community. They're overwhelmed and unable to manage this onslaught of new patients that are presenting because of this. And we're seeing it in other arenas within the medical field as well, in that we just don't have the personnel to absorb the volume of patients that are presenting with this disease, and now the postscript of this disease. We've seen a drop in an increase in the number of physicians who are actually leaving the medical practice. Not as exponentially high as one might have anticipated, but definitely about a threefold increase in retirees. And we're seeing an increase by twofold in the number of practices that have had to shut down for a block of time to sort of adjust to the new medical climate that exists. And needless to say, that lends for a lot of anxiety among the medical personnel. In addition, to have to manage patients in the setting of the availability of a vaccine, now we have to manage patients who are choosing not to be vaccinated and who are presenting with advanced disease. It lends for a lot of apprehension, a lot of anxiety, and in some circles, as you probably can appreciate, some level of resentment that our lives as medical providers don't matter. You hear this the mantra of Black Lives Matter. I ask my patients who present to my office unvaccinated, well, I'm Black. Doesn't my life matter?
Mm.
Does it matter enough to you to come into my office and protect me from potentially getting sick from the virus? So it causes, not only does it cause anxiety and apprehension in the patient population, but the medical providers are overwhelmed in many instances.
That is
That is
significant, and we don't talk enough about
Mm-hmm.
um, the mental wellness of our caregivers in the medical
Mhm.
field.
Mhm.
Yes,
Yes.
absolutely. I
Yeah.
mean, I think that's super important. And, I hear it from my colleagues. I see it in the chat rooms, on social media, but I don't think the public really appreciates how much of this is really kind of an emergency, I think, in
Yeah.
terms of the mental health and
Mm-hmm.
well-being of our medical colleagues, not just doctors, nurses, respiratory therapists, environmental services, people that staff the hospital, make it run, who put their lives on the line, unit clerks who put their lives on the line every day
Mm-hmm.
to deal with the public, but yet the public is fighting against getting vaccinated and taking their lives for granted. And I know people are going to point out, well, there's some nurses that are walking out and quitting rather than getting vaccinated. They're in the minority. They're
Mm-hmm.
definitely in the minority. The majority, 96% of doctors, I think 80 something percent of nurses are vaccinated.
Right.
So those are the people who, you know, are are really kind of fed up sometimes in
Right.
terms of this ongoing debate.
Just so the last one here, is a statement, and then we have a question. The statement is from nurse Meaty Clarke Barnelli. Is ECMO is having a huge strain on nursing care too. ECMO, the machine that Dr. Kingslow mentioned to keep. It's a breathing machine, right, Dr. Kingslow?
It's a mechanism by which we're able to take the blood out of the body and oxygenate it and then
Okay.
put it back into the body. Mm-hmm.
Because the
Okay.
lungs aren't working. That's normally the lungs' job to
Right.
do that.
Wow. So our last question comes from Max Anderson. We see the propagandized narrative that we are in a crime wave. Could the stress of long-term COVID-19 be having an impact on this?
Well,
Yeah, Max.
I'm not a social scientist, but common things happening commonly. I think that may be an influencing factor. In addition, people have been stressed. They weren't able to. A lot of folks weren't able to work, or their family members had to stay off of work. They weren't able to generate income. The supply chains were challenged, not only in the legal market, but the black market. And I'm sure all that influences what's going on in the streets.
Yeah, and I think that's an excellent question. And I think we've all observed people being more on edge just when we go out. I think some of it is, I'm not a social scientist, but I think some of it, is just due to the fact of the overwhelming stress that we've all been under. But then there's the additional physiologic, the body and the mental changes that have happened for people who have been through COVID. And could some of this be related to that? I think absolutely.
All right.
Well, I can't believe that we are at the end of this show. This has been great. I want to thank my wonderful panel, Ceshelle Evans and Dr. Leslie Kingslow. You guys were fantastic. Thank you so much for sharing your wisdom, your knowledge, and your journey. Um, this has been, as I mentioned, I think it's a topic that's not talked about enough. And so I'm glad that we were able to share some light on it, get some great questions from the audience. Thank you, audience. Y'all always come through. And just to summarize, I think that you know there's going to be a lot of work that needs to be done to be able to address long COVID. Um, Cures that need to be found, treatments, but most importantly, avoiding it by getting vaccinated. I think that's really, I hope, one of the take home messages that we've had from tonight. So I'll be on the Russ Parr Morning Show tomorrow morning at 7:47 a.m. East Coast time. Hopefully, if you can join me then, I would love it. And if I don't see you between now and next Monday when we're back at 9 p.m. Eastern on Facebook and YouTube Live, please remember to be wise, to be well, and to be health empowered. Thanks once again for joining me, and to my wonderful co-producers, Lila Mays and Wayne Bruce. Y'all have a great week.
The Weekly Debunk.
Well, you always have to have that weekly debunk.